Hello and welcome to Syed Creative World. This is Syed. For more medical coding videos, subscribe my channel and hit the bell icon. So let's start. And we are going to go for the session today of E&M, that is Evolution and Management. So let's start the class. So we'll just list out the things we are going to learn today. That is introduction of E&M, and we'll see key components in that, place of service, level of service, and there's one more point is critical care services, emergency department services, preventive medicine services. So let's go. Okay, for introduction of E&M, it is also called as 99,000 series. The E&M codes were designed to classify services provided by physicians in evaluating patients and managing their medical care. The codes incorporate the key and contributing components of a physician's service to determine the level of services that the physician provides. The code is then used for reimbursement of those services. E&M codes are categorized according to site and/or type of service provided, such as office, outpatient, consulting, emergency department, and within these categories, the codes are then subdivided according to initial versus subsequent care. Within these categories, the codes are then listed based on the key components of services provided. And again, it is the 99,000 code series. The code range of E&M is 99,201 till 99,499. The third and fourth digit of this code explains what the procedure has been performed. Okay, so you can see here that I've highlighted two of the digits. Okay, so the third and fourth digits. So this will explain the procedure, and the fifth digit explains the level of service. There are certain categories in which the code are divided. Okay, let's see the components required for E&M. There are key components and contributing components. So in key components, we have history, physical exam, medical decision making, also known as MDM. And for contributing components, we have time, counseling, nature of presenting problem, coordination of care. So usually we use the key components. So in the exam, also for the CPC, we will need to learn more about this history, physical exam, medical decision making, these key components. Okay, and a couple of things we also would like to learn here, that three key components required with place of service and level of service to find the correct code. So with that three key components, we also require to learn and to understand what is place of service and level of service. Okay, then only we can find the correct code for E&M. So place of service such as office, hospital, home, nursing home, ambulance, etc. And level of service we have it can be found after evaluating history, physical exam, and MDM. As I told you, these are the key components. There are many other terms that you will learn which are commonly used in E&M, such as new patient, established patient, consultation, chief complaint, concurrent care, family history, and history of present illness. Let's see. Okay, there are definitions as well, so you can pause the video and just note it down if you would like to note the definitions. So I'll just go through one by one. Some new patient. A new patient can be a patient who has not received any professional services from the physician or another physician of the same specialty from the same group practice within the past 3 years. So, whichever the physician has been seen, okay, the patient has been seen from the physician within the 3 years. So it must be established patient, and it would be past if it is a past 3 years, like more than 3 years. So it would be a new patient. Okay. So in established patient, it is written as the same: a patient who has received professional services from the physician or another physician of the same specialty from the same group practice within the past 3 years. Okay. So just understand, the new patient is for the same specialty, same physician, same specialty, and same group. Okay, physician may be differ, but the specialty and the group should be the same. Then only we can assume that this patient is established patient. If he has or she has been seen within 3 years, okay, and any other patient or any physician are seeing the patient after more than 3 years, or for the first time, so it is a new patient. All right. So, and the third point is consultation, a type of service provided by a physician whose opinion or advice regarding evolution and management of specific problem is requested by another physician or other appropriate source. So this is consultation. Actually, consultation, people do get sometimes confused with, like, if someone just refer to, just like some doctor has referred to another doctor, this is not consultation, this is not just consultation. Okay, the consultation means the referring doctor should report and render the patient. First, he should take in the patient and render the services, and then report it back to the PCP, okay, primary physician care. All right, so that is consultation, not just consulting to the referring doctor. That's not just consultation. And we go ahead next. Yeah. Next point is chief complaint, CC. We can also call it CC, chief complaint. You can see this chief complaint on the starting, the initial part of the medical chart, medical records. So this is the first point you should learn, that what is a CC. Then only you can go for the E&M, evaluation and management. Okay. So chief complaint is a concise statement describing the symptom, problem, condition, diagnosis, or other factor that is the reason for the encounter, or why the patient is meeting the doctor. That encounter is written in this CC, that is chief complaint. So what diagnosis the patient needs. So that's why the patient is being encountered with a physician. The chief complaint is usually stated in the patient's own words, and therefore may be in layman's term. Concurrent care, the provision of similar services to the same patient by more than one physician on the same day.